ED discovered on sexual debut is so common. I see that all the time. Heads up, these are some hard questions on erectile dysfunction. I won't go soft on you. Or maybe you are asking for a friend. Hi, I'm Dr. Tan. I'm the Medical Director at Dr. Tan Medical Center in Novena Medical Center. I've been in private practice for the past 15 years, focusing mainly on men's health. So what is men's health, you might say? The best summary I've ever heard is basically we're the men's gynae. So we take care of everything from sexual health, including things like erectile dysfunction, premature ejaculation, circumcisions, all the way to fertility problems and prostate issues. So let's look at the term erectile dysfunction. What is the definition of erectile dysfunction to doctors? Erectile dysfunction is the inability to achieve or maintain a normally rigid erection. If you are a cucumber, good for you, nothing wrong, you don't have any issues. If you are tofu, my friend, better go see a doctor as soon as you can, probably something bad. If you are in between, maybe like a peeled banana, also good to get some medical attention as soon as you can. Now, let us remember that erectile dysfunction is a symptom, it's not a cause. That is an urban legend. If you remember the first answer we gave, erectile dysfunction is a symptom, it's not a cause. When doctors want to determine the cause, the age gives us a clue as to what the cause is. So when we see younger men with erectile dysfunction, we tend to think about more congenital problems or mechanical problems or acute psychiatric problems. Another common cause for young people, you'll be surprised, is actually over-the-counter medications. Things like medicines for blocked nose. So the chemical that actually unblocks the nose constricts the blood vessels, right? And that in turn can cause erectile dysfunction as a side effect. ED discovered on sexual debut is so common. I see that all the time. A lot of the times is because they've never actually retracted the foreskin. So guys who are not circumcised, they never retract the foreskin. The head is extremely sensitive. So think about it. If you have never ever walked bare feet, and the skin on the sole of the feet is so sensitive, when you first start to walk bare feet, you're going to go ow, 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 ow. So same thing for the penis head. For 20 or 30 years, it's been protected by the foreskin. The first time it actually touches something else, the first time it sees daylight, right, it's going to be very, very sensitive. Because of that noxious stimuli back to the brain, they cannot maintain erection, they can't perform. Right? That's not the sad part. The sad part is when the wife looks at him and says, "Why are you like that? Oh, my previous boyfriend's not like that." For older guys, we start thinking more along the lines of hormonal deficiencies, especially testosterone deficiencies, blood vessel blockage issues, especially associated with chronic diseases like diabetes and high blood pressure and high cholesterol. And of course, if the prostate is enlarged, that itself can also cause erectile dysfunction. So let's talk about the prevalence of erectile dysfunction first. As a very rough way of remembering it, the prevalence about equates the age. So 30% of guys in their 30s, 40% of guys in their 40s, and so on. But it's an upward sloping exponential curve. So probably about 80% for guys in their 60s to 70s. Now, the prevalence of BPH also increases with age. So for guys in their 60s or 70s, you're probably looking at a prevalence rate of about 40 to 50%. So if you combine this together, older men in their 60s and 70s who suffer from both ED and BPH is easily above 50%. So the question is, what is this association between erectile dysfunction and BPH or benign prostatic hyperplasia? Every man has a prostate. Every man, as we get older, the prostate will enlarge. It's something completely unavoidable. As the prostate enlarges, it causes many symptoms. For example, a poor urine stream, getting up multiple times at night to go to the bathroom. But one of the symptoms it causes is erectile dysfunction. Sometimes when a more elderly gentleman sees me for erectile dysfunction, the underlying cause is actually BPH. or an enlarged prostate. The problem last time was a lot of the treatments we used to treat the symptoms of enlarged prostate actually cause ED or worsen the ED.
Say what?
Fortunately, now these days we have treatments. It's actually just a pill to be taken every day that can treat both the BPH, the enlarged prostate, as well as the erectile dysfunction. So it's killing two birds with one stone. So if you found this interesting and you want to see more, please like, share, hit that subscribe button. And if you have any more questions, even harder questions, leave it in the comment sections below and I will try my best to get back to you as soon as possible.